frequent or recurring headache, earache, neck pain, upper back and shoulder pain, tinnitus, subjective hearing loss, and vertigo. Those symptoms, if you have one or more of those symptoms and present within the general medical establishment, the last thing, if ever, that the medical doctor, nurse practitioner, physician's assistant will think of, chiropractor, will think of is TMD. If you present with chronic headaches, bad headaches for sure. Patients complain bitterly of temporomandibular joint headaches, very bitterly. And temporomandibular joint headaches can be extremely painful and cyclical. They come and go. They are diagnosed by the medical profession as migraine headaches or at best tension headaches. And the patient is delivered a series of drugs, which don't help chronic inflammation within the temporomandibular joint. They have the wrong diagnosis. That is huge. That one diagnosis, misdiagnosis alone in the United States is done to millions of primarily females, 10% males, 90% females. That misdiagnosis I have observed over thousands of times. Out of those 5,000 treated cases and over 7,000 or 8,000 consultations, seen it constantly. I mean, at least 50% of the patients that I see with TMD headaches, and I've explained exactly how chronic inflammation creates headaches and various facial pains consistently, but when they present to their physician, they're diagnosed with migraine headaches or tension headaches, given drugs, when actually all that you need to do is decrease the inflammation within the joint by resting the joint using a very simple device that unloads the joint. That's all you do with this thing. You unload the temporomandibular joint according to a protocol. You just don't unload it for 10 minutes. You have to use a proper protocol and decrease the inflammation.